Let's talk about accountability, because Governor Kate Brown told us this last week.
We have gone through and vaccinated every senior who's wanted a vaccine that lives in assisted living.
Then some of you reached out and told us,
that's just not true.
I felt that she was either grossly misinformed or she was lying.
And do you remember Oregon's Vaccine Advisory Committee? You know, that 27-person group that's supposed to help us decide who gets the shots next? Well, apparently, they're done. And they wrapped up with 2 secret-ish meetings. So yeah, let's talk about accountability. Here's the story.
And we have a TV show to do that for you. Hi. Called The Story. I'm Dan Haggerty. It's pivotal that you talk to us and tell us what you want to see on this show. It's what drives this whole boat down the river, all right? All the ways to talk to us at the bottom of your screen. Make sure you use that hashtag #HeyDan if you use Twitter. Now, I think if you've watched this show at all, you've probably noticed we talk a little bit differently on this program than other newscasts, a lot differently than the ones you're probably used to seeing. 2 of the pillars of The Story are listening to our viewers and holding people accountable. And we're going to do both tonight, but I will admit, sometimes when we are pressuring the governor or the OHA, the people in charge of this once-in-a-lifetime crisis that is coronavirus, our questions and criticism can kind of feel like we are piling on or maybe making their jobs more difficult. Not long ago, Wayne sent me a message after a story that we did that was very critical of the state, and he said, "It feels like you are drifting more toward gotcha journalism, ready to catch people screwing up. Granted, we need to hold people accountable for wrongdoing, but it feels like you are delighting in their errors." Now, I really want you to understand something here that our government leaders really do already know, most of them anyway. This show works for you. It doesn't work for them, all right? We do it for you, not them. We don't delight in errors because those errors affect you. We hold people to a high standard because that's what you expect from them and from me. If I say something that's wrong or that you disagree with, we talk about it, don't we? I read your email. I own it. And you better believe we're going to do the same with the governor. And that brings us to the big story. See, we learned thousands of our most vulnerable seniors in Group 1A are still right now waiting on the vaccine, even though Governor Brown said on air on this show last week that all those people had already been vaccinated. I know you heard her say that because you started emailing us that very night and saying, that can't be true. And Kristen Severance found out you were right. It wasn't.
So I feel like if she gets this is a death sentence to her.
Lauren and Patricia Ridgely have been anxious to get 94-year-old Laura Bradley a vaccine. The great-grandma lives in an independent senior living facility in Gladstone.
Well, it's frustrating to have absolutely no information as to if they're coming at all now.
Seniors in congregate living facilities are in the state's 1A category to get the vaccine first. They have been eligible for vaccines since December, but many are still waiting to get their first dose, even as Oregon expands who is eligible. On Friday, Governor Kate Brown told KGW's Pat Doris that all seniors in assisted living facilities had been vaccinated, and that was part of her reasoning to open up vaccines to educators. Here's what she said.
We have gone through and vaccinated every senior who's wanted a vaccine that lives in assisted living, that lives in congregate care and in skilled nursing.
We heard from so many of you after that interview saying that's just not true.
I heard her give it that statement, and I felt that she was either grossly misinformed or she was lying.
Or Dr. Dave Gannett. He has a dad in a memory care facility in Portland.
Not everyone who wants a vaccine, who's in congregate care or in a skilled facility, has been able to have one yet.
Alvina Drake has both parents in a senior living facility in Portland.
And she's leading people to believe, oh no, we've got it. We've taken care of the most vulnerable people. And that's not correct. And she can help.
I reached out to the governor's office. Spokesman Charles Boyle said, quote, the governor made an incorrect reference to vaccinations at long-term care facilities. We have completed first doses for all seniors who wanted them in nursing facilities only. Other long-term care facilities, such as assisted living, are expected to receive first doses in the coming weeks.
And my understanding since then is, yeah, she misspoke.
Fred Steele is the state-appointed long-term care ombudsman, an advocate for people living in long-term care facilities. He said 130 nursing facilities have been vaccinated, but more than 550 congregate care facilities are in the process or on the schedule to be vaccinated.
But those facilities, they're not done, but they're in the process and they're actually ahead of schedule.
Welcome news to family members who really feel left in the dark.
And I think that this is wearing on them. And I think that just the sheer fact that they have, if you listen to Governor Brown, they've been overlooked and forgotten. And that's really kind of sinful because they're still here.
There is a lot of information to keep track of. Who's been vaccinated and when. No one faults the governor for saying something incorrectly during an interview. But Fred Steele, the advocate you just heard from, contacted the governor's office Monday about this information not being true. Nothing was ever said or corrected. It's now Thursday. That information stayed out there, confusing and worrying people. Dan, it's just another reason why transparency is so important.
Kristen, thank you. And she's right. One of the most pivotal components to accountability is transparency. You can't know if things are being done the right way if you don't know how they're being done in the first place. See, journalists, as you know, we don't like closed-door meetings, especially ones about, I don't know, let's say who's getting the vaccine next and who's not. See, Oregon's Vaccine Advisory Committee just Zoomed its last Zoom in a private meeting. In fact, their last two meetings were invite only, and you and me weren't on the guest list. Now, to remind you, this is that group of people making recommendations to the state about who should get the vaccine and when. It's a massive panel of 27 people that fills your computer screen like an Oregon version of Guess Who, which may be why Carson asked, who exactly is on the virus vaccine committee and why don't we know what they're talking about, like a transcript of the meetings? So, just to be clear, up until this week, we did know exactly what they were talking about because they were streaming their meetings live. You could tune in and watch them. They recorded them. You could watch them back. They sent out the minutes, as you would expect in this situation. But then, this week, for some reason, they decided to stop doing that. We sent a public records request to the health authority to try and get a copy of Tuesday's closed-door meeting. OHA told us, quote, because this was an evaluation/debriefing, there was no recording. They also sent us a single page of bullet points on what was supposedly discussed in that meeting. The first line says, communication and outreach need to combat misinformation. Well, one way to do that might be, I don't know, not hold secret meetings, especially since one of the primary goals of the committee was to advocate for underserved communities, which you consistently described as people who don't trust the government. Then, this morning, we heard they were meeting in private again today. So we asked this time, we said, OHA, can we listen in, please? And they told us no. They also said this is not a public meeting. It's an unofficial wrap-up because the VAC will not conduct any business, and this is not a public meeting. We will not be recording, taking minutes, or developing a transcript. See, the committee did already finalize its recommendations at the end of last month and said that vaccines should go to people with underlying conditions, frontline workers, people in custody, and people living in low-income and group senior housing. So these final meetings were about nobody knows, which is the point of this. There are laws about government agencies keeping you in the dark in this way, and I talked to law professor Paul Diller about the legality of what they were doing.
The law does have exemptions for certain kinds of recordings or records that are designed to protect privacy or operations of government that the legislature thought should remain secret. I'm not aware of a post-recommendation debriefing exemption to the public records law, though.
You know, we're not accusing anybody of doing anything sinister behind closed doors, but just the idea that the doors were closed makes me as a journalist feel uncomfortable.
I understand. So then this would fall under perhaps a loophole in the public record system, because the public records law itself doesn't necessarily require that every meeting be recorded. In normal times, I think boards and commissions meet in places where the public can get in. But what's different here is that this was a Zoom call, so only taking place virtually. And unless you had the password, you couldn't join in.
So, some people are probably going to hear this and think this is kind of inside baseball, TV, journalist people making a stink about something to put their foot down based on transparency and whatnot. But do you have a take on kind of the bigger picture of keeping the pressure on public bodies to be transparent with the people they serve?
To me, this isn't inside baseball at all. This is exactly the kind of concern we have when it comes to public records and public records advocacy.
Now, I want to circle back to Carson's question that we read a little bit ago. He also asked who exactly is on this vaccine advisory committee. Well, we showed you the 27 people, the Zooms there, but they come from different organizations. Those include people from county health departments, private health clinics like Providence and Adventist Health, nonprofits and advocacy groups like the Council on Developmental Disabilities, and groups representing communities of color like the Oregon Pacific Islander Coalition and PCUN, which is a Latino labor union. I got a chance to talk to one of those committee members today from the Somali American Council of Oregon, who actually wonders if their work, everything that they have done, all of these meetings, and all the controversy that went along with them, will actually make a real difference.
Is there concern that there won't be follow-up with this group, or that the things that you discussed over the past several weeks won't be implemented in a way that you hope that they are?
Oh, absolutely. I have a concern, especially somebody from the Black community who have experience, or BIPOC community has experience of not getting the service or underserved, especially at the local level. We don't want to start something and just leave it there. It's as far as success is kind of defined differently. Success would be ultimately when all Oregonians are cured and vaccinated, and COVID-19 is out the door. But until we get that, I don't know if I can call anything a success at this point.
He also told me a little bit about the private meetings. I was curious, so I asked. He said that, of course, there was nothing really controversial in his opinion that was discussed. He also felt like members had the feeling that maybe they could let their hair down a little bit and speak frankly without people like me listening in and judging everything they say, so I get it. He also said they discussed reconvening in a few months with the OHA, something that he is confident will happen. I'll make sure to check my inbox for the Zoom invite. Now, speaking of being left in the dark, I think that's how a lot of seniors in Oregon feel right now. People who are 80 or older who live on their own are supposed to be able to get their shots starting on Monday. But we're getting all these messages from people, some of you who are eligible, right? Or maybe you have parents who are eligible and waiting your turn in line, asking, what's the deal? Where are the specifics? Where can I sign up and get this vaccine? So let's go to a new segment called Can Seniors Sign Up for the Vaccine Yet? No, you can't. Sorry. Yeah, I know you are supposed to start getting the shots in 3 days and you still can't sign up yet. And I agree, that seems like a bad plan, but we have Pat Dorse digging into this for us a bit.
Well, it's interesting, Dan. You take a bunch of 80-year-olds and you tell them, go ahead and sign up online. And by the way, this is all going to start on Monday, but don't worry, you don't need to sign up. In fact, you can't sign up until Monday. I mean, what could possibly go wrong? It's amazing. We've been pushing all week. We've been hearing from lots and lots of seniors saying, for crying out loud, why can't you make this simple? Give us a phone number to call so we can pull out our calendar and schedule the darn thing. I've heard from a good number of adult kids who are trying to get schedules and appointments for their parents, and they're having all kinds of trouble, and that's because now we've learned that you cannot sign up until Monday. So makes no sense to me, but that's apparently what the OHA is doing, and there's going to be a ton of people, something like 168,000 in that first week, who are 80 and above who become eligible, and there's going to be about 19,000 doses for them. So it's going to be a real challenge, and I don't think anybody's going to be happy when it's done. But the next week there's going to be more people and more people and more people, and the OHA says kind of what the governor told me last week, and that is it's going to take 4 months to get through this group. 4 months, everybody, and then we'll start talking about who else is in 1B.
Pat Dorse, thank you. there is some progress to talk about. It's not all doom and gloom, all right? So we want to take a look at Oregon and overall how we're doing with the vaccine doses and what we're handing out. As of this afternoon, more than 369,000 people have gotten at least their first dose. And some of those people have gotten their second dose as well. But we're talking about the first dose here. I think that's the best number to represent our population who are getting inoculated. And that comes out to be about 8.7% of the state's population with at least one shot. That actually puts Oregon in the top quarter of all states for percentage of people vaccinated. So a little victory there. I like that. Now, in Washington, more than 627,000 people have gotten at least their first dose, which works out to be 8.3% of the state's population. So a little behind Oregon, but still in the top third of all states.
When the story continues.
I thought it was a misprint. I honestly was shocked.
You might want to check the price when you refill your prescriptions.
This January, we saw the most increases ever.
And I know a lot of you are upset about inmates getting vaccinated first, but let's take a look at just how many outbreaks prisons in Oregon are dealing with, because it's a lot.
I always look through messages and emails during the commercial breaks, try to think about some of the stuff I might want to address at the end of the show. You can leave Facebook comments too. We're also on Instagram, both The Story at KGW and Dan.Haggerty, so you can kind of message. There are a million ways to get in touch with us. Just pick the one that works best for you. Now, I know we've been all kind of COVID here all the time recently, and for good reason, but let's talk about another medical-related issue that you might not know about. See, drug makers are charging you more for prescriptions. Prices started spiking over the past few weeks, and this has shocked a lot of people. Here's investigative reporter Kyle Aboshi.
With so many people focused on the COVID vaccine, drug makers have quietly been raising the price on hundreds of brand name prescription drugs.
I thought it was a misprint. I honestly was shocked.
Kate Johnson saw the price of her medication for an autoimmune disorder skyrocket from $30 to $80 for a 3-month supply.
My insurance is the same, and I called the pharmacy right away, and I said, this can't be right. And they said, yes, it is.
The price hike came with no warning, forcing the Gresham woman to reshuffle her household budget.
Luckily, I'm still working, but many consumers who need medications daily aren't working. And so to have that boost is just, in prices, is unbelievable.
So why the increase, and why now? Tori Marsh of GoodRx tracks prescription drug prices.
Every July and every January, we see drug manufacturers, increase prices on drugs. This January, we saw the most increases ever.
In the month of January, drug makers increased the price of roughly 800 different prescriptions, with an average price hike of more than 4%.
Many of these are already really expensive brand-only drugs that don't have any affordable alternatives.
The price increases are for a drug's list price, or the official price set by the manufacturer. In reality, almost no one pays the list price because of rebates and discounts. But research shows price changes do eventually trickle down to consumers, affecting what you and I pay at the pharmacy.
We would think they'd wait, because this is when we're probably at our worst right now with COVID.
As a consumer, there are a few things you can do to reduce prescription drug costs. First, shop around.
Yeah, I was hoping to check a couple prices if I could.
In a 2018 KGW investigation, we saved over $500 on common prescription drugs by comparing prices at pharmacies in the same town.
We shop around for our TVs. We shop around for cell phones. But one thing that isn't normal right now is shopping around for prescription drug and healthcare in general.
You can also save by checking out buying clubs like Costco or Sam's Club, and don't need to be a member. Consider online pharmacies. They often have low prices. Ask for in-store discounts and shop for coupons online. And finally, talk to your doctor. Ask if you really need a drug in the first place. And if it is necessary, ask how much that prescription is going to cost. That little bit of persistence and research can help you save at a time when drug makers are raising prices. Kyle Aboshi, KGW News.
Now, if you've been watching the show recently, you know we've been talking a lot about inmates getting vaccinated, especially since a judge just ordered that all state prisoners are now eligible for the vaccine immediately. Now, this has been a two-way conversation, as we always do on this show, and a lot of you are not happy that people convicted of crimes get to jump the line. But RR emailed me with a different perspective. RR said, I work a civilian job over 20 years at Multnomah County Detention Center downtown. I also advocate for vaccines for all inmates, even short stays. Most of the inmates I see seem like my family or friends and neighbors. Not surprising since they are. You'd be surprised how many people you know who have been to jail. So that's true for a lot of people. People in prison, they have family members, and those people care about them. Of course you know that. We talked to two women who both have fiancés in prison, people they haven't been able to see for nearly a year because of the COVID restrictions. One of them actually caught COVID in custody.
He lost his taste and smell. He's had and he's not somebody who ever really has headaches or gets sick, but he's been really lethargic. He got horrible headaches. He did have a couple scary nights where he was, struggling to breathe a little bit. Nothing too outrageous, but yeah. And then the biggest thing is he's had outrageously high blood pressure that was kind of getting poo-pooed by the nurses there.
I'm used to going to visit him like maybe at least 3 times a month and having a visit like every other weekend. And it's been it will be a year this month since I haven't seen him, since I seen him the last time. So it's pretty hard. So now that they have a vaccine for them, I'm super excited. So hopefully visits can open. Fingers crossed.
Now look, this isn't just about having compassion for other human beings. I mean, a lot of it is, but we should look at the facts as well. 7 of the 8 largest workplace outbreaks in Oregon are all from state prisons. The top 4 are all prisons in Eastern Oregon: Two Rivers, Snake River, Eastern Oregon, and Deer Ridge Correctional. The next 3 largest outbreaks are from Western Oregon: Oregon State Correctional, Coffee Creek, and Oregon State Penitentiary. The only non-prison on this list is Amazon Troutdale. I could probably figure out a joke to put there, but I'm not going to. 1 in 4 prisoners in Oregon have tested positive. 42 have died. Nearly half of those deaths happened in the past month. So like I said, this is about having some humanity, right? But it's also about looking at where the virus is spreading and who's dying from it. Now, we've been talking a lot on the show about all the trash piling up around Portland, and a lot of you have been asking how you can help. Well, Maggie Vespa's got one idea for you as we finish the story right after this. Just reading through a couple comments. We're going to get to a few of those in just a minute. But before we wrap things up tonight, I do want to talk about Portland's trash problem. We've been covering this all week, and you can find the coverage online pretty easily. As you probably know already, Portland looks terrible right now. And the program that is in charge of cleaning up the trash and getting rid of the graffiti say that they just cannot keep up. The mayor said he's working on a plan to tackle all of this, but in the meantime, a lot of you have been asking what you can do. Audrey wrote in and said this: my partner is lucky enough to get paid volunteer hours at his work, yay Rivermark. And so next week, we are wanting to go out and pick up some trash. Do you have recommendations on where we should start, or if we should contact anyone before starting? Audrey, yes, we do. Here's Maggie Vespa.
Portlanders who want to tackle trash have a seasoned ally in Solve.
And so we definitely have a litter problem here in Portland and here in Oregon.
Solve stands for Stop Oregon Litter and Vandalism. The nonprofit has been around since the 60s, and they organize hundreds of cleanups across the state every year.
And Solve is all about empowering and supporting people to pick up trash.
Thursday, they met up at the Springwater Corridor in southeast Portland.
The last item is unidentified liquids.
Volunteers are given instructions, which include a list of items to avoid. Biohazard teams contracted by the city will get those later. Solve currently has a partnership with the city. It's called Keep It Pretty Rose City. Mayor Ted Wheeler championed it earlier this week as part of
the work we're already doing in our business districts and the downtown area to increase litter collection and graffiti abatement. Again, it's not enough, but it's a good start.
Later, the mayor noted city staff are working on a plan to ramp up cleanup programs. No word on when that will start. For now, they're pushing Portlanders to work with groups like Solve. Volunteers can sign up online for organized cleanups or host their own. If that interests you, Solve staff will help make it happen.
The bulk of work that Solve does in the community is not led by staff. It's led by everyday people who want to take on a leadership role, get basic training, get equipment, and then go out with their friends, families, and community groups and do something in the community.
For more information, head to kgw.com. I'm Maggie Vespa reporting, KGW News.
Hey, let's get to a couple of comments. James wrote in and said, hey, Dan, please continue to hold the VAC, the Vaccine Advisory Committee, accountable. They appear to have an agenda they don't want the public to know about. Actually, their entire what they're doing is letting the public know about their agenda. That's literally the entire purpose of this group. I'm not trying to hold the individuals of this group accountable for anything. They've been transparent through all of this about the goals that they were set forth to do. These are good people who, most of them, if not all of them, volunteered. They're not getting money to do this. These are people who are helping the community already and now came together to try and help in this effort. So it's not really them. We're talking about the transparency of government allowing us to hear what these people are discussing when they're talking about something that impacts all of us, and they're in a position to aid in decision making. Peter wrote in and said, public meetings are required when decisions are made and when information relevant to a pending decision is considered. If this advisory group already made all the decisions it was charged with making, the public meeting law probably didn't apply to those two meetings. That's a good point, and it's certainly an argument they could make, but it's kind of contingent upon one interesting factor. If the governor does act with this group again in the future, it kind of changes the significance of those two meetings. If they never talk to him again, yeah, they could say there's no difference between doing that and meeting up at a bar somewhere in a normal time and discussing what they had talked about over a couple of beers. But if they continue to work with them, we'll see. We're going to continue to get the answers. I like the way you guys are thinking. We have really smart viewers, as always. This is The Story. I'm Dan Haggerty. The news at 6:30 is next. We'll see you back here to close out the week on Friday.